Thank you to all of you who came today to find out more about how our housing system consistently fails disabled people and what we can do to change these. So the way I want to start this conversation today is to start by saying that many of you on this call will know really well that the housing crisis we are experiencing is clearly an affordability crisis. Everybody knows really well that we need to build more public housing and we need to retain as many homes as possible in the social rented sector. But what we really don't hear many people talk about is the fact that this housing crisis is not just an affordability crisis, but it is also an accessibility crisis that disproportionately impacts disabled people and older people. So what today I'm going to do, hopefully I won't take a lot of time, I will talk about what housing barriers disabled people face in London on a day-to-day basis, drawing on our latest research findings, but I'll also explore why we're not building the homes disabled people need in London, and also what decision makers can do to remove housing barriers we face. Next slide, please. So, why we did this research and why it is important? Well, first of all, you have to know that most research out there has been conducted nationally, is being conducted on a national scale by disability charities that are not user-led. And most research is mainly focused on the needs of wheelchair users and how the lack of accessible housing impacts their life. Our research has taken a slightly different approach. First of all, we are a user-led organization, so this research is being carried out by disabled people, for disabled people, with disabled people. Is a research focused specifically on London, so on the experiences of people living in London, so it's quite like context specific. Also, we did not just look at accessibility, but we also examine the intersection between affordability and accessibility, because we at Inclusion London believe that there is no point of building accessible homes that are not affordable, and there's no point of building affordable homes that are not accessible, because people need both in order to be able to live full and independent lives. And also in this research, we didn't just focus, as I was saying, on the housing needs of wheelchair users, but we also investigating the housing needs of people with different kinds of impairments, which means neurodivergent people, blind people, people with sensory impairment, people with learning difficulties, and deaf people. And also, we spoke with people living across different tenures. So we spoke with people renting privately from the landlord, people renting from the council or housing associations, people also who own their own homes. So we have a good understanding of what some of the issues that people face across different tenures. Next slide, please. What we try to find out through this research? So, with this research, we really wanted to explore the housing challenges disabled people in London face on a day-to-day basis. We looked at both accessibility and affordability challenges, and most importantly, the impact that living in inaccessible and affordable homes has on people's lives. But also, what we wanted to do was to find out the barriers the local authorities face in delivering accessible homes, and we spoke with them directly. We also looked at evidence base of both the GLA and local authorities, which mainly means data and policies. And then we also wanted to understand whether policies in the London Plan and the GLA's funding programs, and primarily the affordable homes programs, are really effective in increasing the supply of accessible social rent homes. Next slide, please. So how did we gather our evidence? Just really quickly, we conducted a literature review of existing research and data sets, because we had to know what research had been done on this topic. We analyzed GLA's data and policies. We also looked at all local authorities' development plans, local housing market assessment. But in terms of primary research, we conducted an online deep dive survey with deaf and disabled Londoners because we really wanted to capture the housing experiences of different people. And we also interviewed 22 disabled people to better understand the impact of living in accessible and affordable accommodation. In terms of evidence that we gathered from local authorities, we submitted freedom of information request to all 33 London local authorities, primarily because we wanted to understand what data they have on disabled people housing needs in their areas, and also what data they have got on their housing stock. And we also interviewed some local authorities, primarily people from planning and housing teams, because we really wanted to hear directly from them what they believe prevents them from building the homes people need. Next slide, please. So moving on to our research findings. What do we know about the state of accessible housing in London? We know, and this is not our research, it's GLA's own data, that only 3% of existing homes in London are visitable. And just to say that when we talk about visitable, we mean that these are homes that they only got some features, such as, for example, level access, or a toilet on the same level as the entrance, or wide doors, for example, that can be visited by a disabled person. That doesn't mean that a disabled person can live in these homes long term. So imagine what it means to live in a city where you can only visit only 3% of spaces. That gives you an idea of what the situation is. Next slide, please. What we also know, again, this is GLA on data, not ours, is that wheelchair users in London are not only more dissatisfied with their accommodation than non-disabled people, but they're also more likely to be dissatisfied than other wheelchair users in the rest of the country. So basically, wheelchair users in London are not very happy about their housing situation. And actually, this is a shocking finding, considering, and I will talk about this later, that London sets very high, actually higher accessibility standards in London than the rest of England. So in theory, you would expect satisfaction among wheelchair users to be higher in London than the rest of England, but that's not what we found. Next slide, please. So what did we find? We found that 1 in 4 people live in completely inaccessible homes where they can't safely and easily use basic facilities like kitchens, bathroom, and entryways. What we also found is that 1 in 3 people with mobility impairments do not have level access in their homes at all. So that means essentially there are people who really struggle to get in and get out of their homes, which is actually quite shocking. So just imagine for a few seconds, would you live in a home where you can't shower or use a toilet, where you can't cook a meal independently? Would you live in a home where you are confined to only one room? Many disabled people don't have to imagine this because that's how they live their life. And I'm sure you would all agree that's not acceptable. But yeah, so moving on to the next slide, what we found is that it is not just people with mobility impairments that need accessible housing, but it's also people with different kinds of impairments who need it. So neurodivergent people, people with mental health support needs, deaf people, people with sensory and visual impairments, all need accessible housing to live well and independently. And I've gathered here a few quotes that you might read in your own time, but these are just some of the things that people told us when we basically spoke to them about the accessibility of their own accommodation. Just to summarize, many people we spoke to told us that they struggle with poor lighting in their home, with the lack of noise reducing insulation, lack of thermal comfort as well, and also layouts in the home. A lot of people with visual impairments find some of the layouts in their accommodation quite impractical and confusing. Some people have told us that they walk into cupboards. Equally, people with a lot of sensory sensitivity find it really disabling to be in an accommodation where they just hear everything, a lot of noise, and equally lighting has a big impact on people's as well, especially fluorescent lighting. So essentially, all of these issues exacerbate people's impairments and prevent them from being able even to access some parts of their homes. So essentially, what we have been trying to say through this report is that accessible housing goes beyond provisions for people with mobility impairments. It's also about ensuring other inclusive design features such as adjustable lighting, noise insulation, thermal comfort, wayfinding layouts are present in the home. Next slide, please. Another key finding about research, which won't surprise many of you, that it is not just the accessibility of the home that matters to disabled people, but also the accessibility of the area in which they live. And over half of people that responded to our survey told us that their local areas are not accessible. And that's mainly because of the lack of accessible transport networks, such as tube or even like bus stops that are close to their homes, lack of healthcare facilities, shops and services near their homes. But people also told us about the challenges that they face in navigating the street space in their areas, such as, for example, poor and uneven pavements, lack of dropped curbs. And all of these barriers limit people's ability to engage in community activities and live independently. So what we've argued in this report is that accessible homes need to be built and allocated in areas of London with good accessible transport networks, but also we must consider the accessibility of the street space and the proximity of homes to essential services such as shops, healthcare facilities, and support networks as well to enable disabled people to live independent lives. Next slide, please. So as part of our research, as I anticipated at the beginning, we did not just focus on accessibility, but we also explored whether people can afford their housing costs and the impact this has on their lives. And we did explore this for two main reasons. One is because we know that housing costs in London are significantly higher than anywhere else in the rest of England. But we also know that deaf and disabled people are more likely to be living in poverty than non-disabled people. And we know that 30% of families in London with a disabled person are in poverty. We know that it's more difficult for disabled Londoners to afford their housing costs compared to non-disabled Londoners. And you know, these are actually worrying statistics, as you can tell, but in a way, being a deaf and disabled people organization, some of these statistics are not very surprising to us because we know it costs more to be disabled. And Scope, in their latest disability price tag report, estimated that disabled households need an over £1,000 extra a month to have the same standard of living as non-disabled households. And the fact that poverty rates are so high for disabled people explains why disabled people have a greater need for social rent housing. And when we actually spoke with people, it was quite apparent that social housing is for many the only tenure that can provide the affordability and security that people need. However, despite this need, despite the high demand for social housing, there are not enough social rent homes that are accessible. We know that over 23,000 London households are currently on a waiting list for social housing because of medical or welfare reasons, which is actually quite a high number. Next slide, please. So in our research, what we found is that roughly 1 in 6 people are spending more than 50% of their income on rent or mortgage. And unsurprisingly, you can imagine that most of these people are private renters. nearly 2/3 of people told us that they had to cut back on something to afford their housing costs. Roughly 1 in 2 people had to cut back on social or recreational activities, but 1 in 3 also had to cut back on food, essential gas and electricity that they need to survive. And I just wanted to highlight that for many disabled people, cutting on food and heating devastating consequences on people's health. A lot of people have to manage their body temperature, which is why they need heating in their home, so they can't really choose between the two. Next slide, please. We also try to understand if people are happy with their type of housing, which you don't hear a lot in the media. So if people are able to stay in their homes long term and the impact that this has on people's lives. And what we essentially found is that it's not just housing affordability that matters to people's well-being, but it's also security of tenure. And so by security of tenure, we really mean the feeling of being able to live in a home long term. Unsurprisingly, I would say we found that disabled tenants in the private rented sector are particularly dissatisfied with their tenure because they have to battle with very high rents, sudden rent increases, the higher risk of being evicted by their landlord. And because of this sense of insecurity, disabled tenants, they often are discouraged from requesting essential housing adaptation to their landlords, because often landlords treat these requests as complaints rather than reasonable adjustments. And often what happens is that they prefer serving Section 21 or increase their rent so that they can push tenants out of their homes and not do the adaptation that they need. In contrast, social housing tenants and people owning their own homes are more satisfied with their type of housing because of the sense of stability and a sense of community that kind of tenure gives them. And these allow them to better manage their health condition as well. And something that we did find, though, is that there is a bit of a difference between council tenants and tenants renting from housing associations. We did find that disabled people renting from housing associations were more dissatisfied than council tenants, primarily because of higher rents and service charges. Next slide, please. So, how does living in inaccessible homes impact the life of disabled people we spoke to? Well, living in inaccessible homes compromises disabled people's physical and mental health. And crucially, and I'm going to emphasize this, deprive people of the rights to live independently. Many people we spoke to told us that they leave their homes less often because they can't get in and out of their front door, for example. And this severely impacts their ability to work, study, socialize, and many people isolate from others because their home is inaccessible. Many people told us that they have to sustain physical injuries because their home is inaccessible. Many told that they can't shower or cook without relying on carers or partners because their kitchen and their bathroom are not accessible. And I've gathered here again some quotes that sort of show the impacts that this has on people's lives. But I think often what we don't talk about is the impact that living in inaccessible accommodation has on people's mental health. Like people experience so much chronic stress, anxiety, and in some cases depression, to the point that many had to be hospitalized because their home wasn't accessible. And I think that's we don't want to live in a society where people are experiencing such level of trauma because their home is inaccessible. But that's the reality. And I think what we found is that people living in a home that doesn't meet access need not only makes people ill, but it makes them feel like their lives are less worthy and they are a burden, which is absolutely unacceptable. And I think because we explored both accessibility and affordability, what we found is that living in a home that not only is inaccessible, but also unaffordable and insecure, compounds the negative effects of inaccessibility, and so people's well-being end up deteriorating. So what we basically have argued in this report, that we need to tackle accessibility and affordability barriers at the same time if you're really serious about tackling health inequalities and ensure disability equality in housing. Next slide, please. So I'll turn now to the second part of the research, where we mainly looked at policies, data, funding programs, and general barriers that local authorities face in basically ensuring that the delivery of accessible social rent homes. I'm just going to quickly say that probably this doesn't come to a surprise, it's a surprise to many of you. Demand for social housing is very high and is massively outstripping supply, even in London. And that's because we're not building enough homes. And also we've got a policy, which is right to buy, that through which we continue to deplete our social housing stock. So local authorities are finding themselves in a situation where they don't know how to house people, and they face significant pressures. And they face significant pressure in housing disabled people because they're just not building enough homes that are accessible and wheelchair accessible. And I will talk more about this today. Next slide, please. So since demand is so high, but supply is low, what do we need for supply to match with demand? Well, certainly we can't continue doing what we're doing. We definitely need changes at all government levels, which means changes at national, London-wide, and local authority level. What we really need is for all governments to properly assess disabled people housing needs and plan properly. They need to plan the home, to build the homes people need. They need to have a good database about disabled people. They need to know their housing stock. And also they need to deliver the homes that people need. And for that, they need funding to be able to build the homes. So what we did was to look at barriers and gaps in funding, in planning policies, challenges with delivery, and whether funding programs really support the delivery of accessible homes, especially in the social rented sector. Next slide, please. So what we found is that many local authorities in London rely on a very weak evidence base in assessing disabled people housing needs. Many councils don't know people's housing needs, disabled people housing needs. They are unable to estimate how many people are likely to require an accessible home in the future, which is what good planning should be about. They also lack basic accessibility information on their existing housing stock and the new homes they are building. Many councils, for example, do not know how many homes that they are building are accessible. They don't know how many can be adapted, how many homes they are specifically suitable for wheelchair users. And most importantly, they don't know how many accessible homes are actually affordable. So, for example, they don't know if the accessible homes they are building are for market housing, let's say for sale, for social rent, and so on and so forth, which is a big problem when it comes to planning and building the homes that people need. And a shocking finding from our Freedom of Information request is that only 2 councils gave us the complete 10-year breakdown of their approvals and completions for new build accessible homes, which basically means that they don't know, only 2 councils know how many accessible homes are affordable, basically in the areas, which is not what it should be. Next slide, please. So we not only looked at data, but also we tried to understand whether planning policies are supporting the delivery of accessible social rent homes. So in London, for those of you who are not familiar with this, and I'm more than happy to have a discussion about this later, the London plan encourages borrowers to build general needs accessible homes. So compared to the rest of England, in London, there are higher accessibility standards in place, in theory. And so according to the London plan, 90% of new homes have to be accessible or adaptable, while 10% of homes need to be built to wheelchair user standards. And so this means, in theory, again, that if you have higher standards, disabled people should have better chances of finding suitable accommodation than other areas in England. Next slide, please. However, this is not what is actually happening. We found that compliance with existing accessible housing targets have significantly declined over the last years. And just to say that this is not our data, this is GLA own data. And according to GLA's own data, on average, local authorities in London are not meeting accessibility targets set out in the London plan. As you can tell from this graph, approval and completion rates are quite low. And the thing is, it's not quite clear why these figures are so low. It's not clear whether local authorities are not just building the homes to accessible standards, or whether the data they are reporting to the GLA are inaccurate. In either case, we think there is a big problem here, and then there is a significant disparity between what is being reported and the target that should be met. And so we really believe that the Mayor of London, the GLA, should really investigate why there has been such a declining trend in compliance with these targets and urgently tackle this problem. And it seems that currently this is not a priority on the agenda. Next slide, please. So our research not only found that existing accessible housing targets are not being met by all local authorities, we also found that existing targets are probably not entirely adequate. We found specifically that both the GLA and local authorities are not paying attention to whether the wheelchair user homes that are being built are fully wheelchair accessible or wheelchair adaptable. And this is a problem. I'll explain why that is. So, and if you recall from one of the slides earlier, I was saying that 10% of new homes in London have to be built to wheelchair user home standards. Now, according to the building regulation, the national building regulations, you can either have fully wheelchair accessible homes, the so-called M43B homes, or you can have M43A homes, which are basically wheelchair adaptable. Apologies for the technicality, but I'll try to do my best to explain why the difference it is important. So a wheelchair accessible home is a home that where a wheelchair user can move immediately into and live independently. Because, for example, the kitchen is accessible, the bathroom has a wet room, for example, so that home is immediately available and accessible for the person. A person is going to be allocated that property and is going to be able to live in independently. A wheelchair adaptable home, instead, is a home that requires adaptation specifically to the bathroom and the kitchen at a later stage. So what that means is that a wheelchair user who is allocated a wheelchair adaptable home is allocated a home that is not totally accessible, and it is a home that might need adaptations that will be funded by the local authority through the Disabled Facilities Grants, also called DFG. These adaptations, for some of those of you on this call to have had to go through the process, take a long time to be approved and installed, which means that a lot of wheelchair users who need these homes have to live in unsuitable accommodation for a longer period of time. But also, it is more expensive for local authorities to adapt a home that could have been built fully accessible from the outset. So what we've argued in this report is that we really want to see more fully wheelchair accessible home. We really need to try to understand whether we are building wheelchair accessible or wheelchair adaptable, because nobody is actually monitoring this data. We found that 26 boroughs set no targets for fully wheelchair accessible homes. And the London plan doesn't make any distinction between these two standards. Next slide, please. So our findings also suggested that there is a massive disconnect between affordability and accessibility. 24 out of 33 London boroughs made absolutely no plans for affordable, accessible homes. And this is actually quite shocking because, as we were saying earlier, there are so many disabled people who are languishing on social housing waiting lists. So we really have to look at both at the same time. In the London plan, there is no coordination between affordable and accessible housing targets. And also, there is no requirement in the London plan for a proportion of wheelchair user homes to be built in the social rented sector. So essentially, if we've got a lot of wheelchair user homes, we've got 10% of wheelchair user homes being built in, for market housing. Who is going to be able to afford these homes? That's a big question that we've asked ourselves when doing this research. Next slide, please. So while it is important to build affordable home, it's also crucial that homes are genuinely affordable. What we found is that building affordable homes is a priority in the London plan, but just to say that what is considered affordable is not just social housing. Affordable now means many different homes for rent and for sale, such as, for example, London living rent, shared ownership that are way more expensive than social rent, and these are called intermediate products. So we know from this research, at least, that most of the disabled people we spoke to can't really afford intermediate products. And for many people, social rent is the only tenure that can provide the affordability and security people need. Of course, there is a minority of disabled people who are going to be able to afford London affordable rent and share ownership, but it's not the majority. And so with over 23,000 disabled people waiting for an accessible social rent home, certainly you would expect the GLA and local authority to prioritize building accessible social rent homes. Next slide, please. So where we find that existing planning policies have some limitations and there are a series of issues in the planning system, there are also issues with delivery. We found that some local authorities have limited knowledge of accessible and inclusive housing design standards, and even those local authorities who have an understanding, they lack capacity in their planning departments to be able to enforce compliance with the standards, which is one of the reasons why we see less accessible and wheelchair accessible homes. Next slide, please. But also, another key issue that hinders the delivery of accessible social rent housing is developers. Developers escaping from their planning obligations. So councils told us that it's very difficult for them to get developers to build accessible homes, especially in the social rented sector. And what actually happened is that developers use viability assessment to argue that it is not financially viable for them to build these homes because accessible and wheelchair accessible social rent homes tend to require more land, and so they cost more to build. So what often happens is that developers say that the only solution to make developments viable, i.e. profitable, is to either reduce the number of accessible homes or build wheelchair user homes that have to be adapted by the local authority rather than building fully wheelchair accessible homes. Or they build accessible homes in more expensive tenure, such as share ownership or market housing, which, however, as we already explained, a lot of people can't really afford. And on the other hand, council told us they struggle to challenge developers who are trying to reduce the level of accessible, affordable housing because they don't have enough technical expertise and resources to challenge these technical viability appraisals. Next slide, please. And another key issue, of course, with delivery is funding. So we know that to build accessible homes that are generally affordable, it's important that there is enough capital grant funding given by national government to the GLA under the Affordable Homes Programme. And just to say, the funding under the current AHP is used to help providers with the cost of building affordable homes for rent and for sales. So this is a bit of a technical part, and I'll try to explain it to the best of my ability. So the GLA, what they do, they negotiate with central government how much funding is needed in London to build affordable homes, and also what type of affordable homes this funding needs to be allocated to. So the mayor and the government, they last agreed that 53% of funding under this program should be allocated to the delivery of social rent homes. And the remaining 47% should be allocated to intermediate products, such as, for example, shared ownership. So we expressed two major concerns about funding. First concern is that funding is probably unlikely to be sufficient to build the accessible homes in the social rented sector to the scale that we want them to build. And the second is that too much funding is allocated to intermediate products. Building accessible homes, and specifically wheelchair accessible homes in London, is already expensive. And building them in the social rent sector is even more expensive, as I said, because they require more land and they cost more to build. What we found is that when the GLA estimates how much funding is needed in London to build affordable homes, it seems that they don't factor into their calculation the higher cost of building accessible homes, especially in the social rented sector. So we've argued in this report essentially that the grant funding that the GLA negotiates with and receives from central government is probably not going to be sufficient to support the delivery of new build homes that we believe they should be built. And the second concern that we've got is that the funding balance under the Affordable Homes Programme is probably not appropriate to boost the social home building that we want to see. And that's why we believe the GLA should make sure that, should negotiate with central government to make sure 80% of funding under the next Affordable Homes Programme is allocating to social rent homes. And also, what we are very concerned is that funding for disabled people housing under the Affordable Homes Programme seem to be primarily directed towards specialist and supported housing rather than to general needs accessible homes. This is very concerning for us because, of course, while some people might need supported housing, we know not every disabled person needs and wants to live in supported housing. So the fact that funding is directed towards that, I think, is a bit concerning. I'm also conscious of the time, so I guess I'll just quickly say that we've also looked at the council acquisition program, and so we looked at the existing housing stock because we can't just rely on building new homes, but we also look at what we actually already got and whether the program maximize opportunity to retrofit homes. And we believe that, again, the funding under CHAP does not account for the higher cost of acquiring existing accessible homes. And next slide, please. So to conclude, what we've basically have shown through this report is that there are many disabled people who are trapped in unsuitable homes, struggle to afford their housing costs, and that's because there are not enough general needs accessible social rent homes. So what can be done to change these? Well, the GLA, national government and local authorities should all really work together to make accessible housing a priority for starts, because it doesn't look like it is at the moment. And they should all work together to massively increase the supply of accessible social rent homes. What we definitely want to see happening is real co-production. We want them to co-produce all our housing policies with deaf and disabled people in our organizations. We want to see specifically we want them to build fully wheelchair accessible home in the social rent sector. Also, we want them to retain as many homes in the social rent sector and retrofit them to the highest accessibility standards. We also want them to boost acquisition of market homes, to repurpose them for social rent and retrofit them. But also, while we build all of these homes, we really need to make sure that disabled private renters are provided the security of tenancy that they need, and people should be protected from spiraling rent costs. Next slide, please. Our report, if you look at it, has got a lot of practical recommendations. There is many of them. Can you move to the previous slide, please? But just to say that here I've just captured what are the key main things that we would like decision makers to do. And some of the things are about developing clear plans, set out ambitious targets, and of course enforce them, because there's no point of having targets that are not being met. We want them to improve data on disabled people housing needs, accessibility of the housing stock. We want them to boost capital grant funding. We want council to upskill themselves on inclusive housing design standards, and the government to invest more in planning teams. We want right to buy to end, and we believe the viability assessment process needs to be reformed because at the moment it's not working. And also we believe that we need to regulate rents in the private rented sector, abolish Section 21, but also introduce a legal duty on private landlords to consent to adaptations. Last slide, I think. How can you help as well in the housing movement? This is a question I get asked a lot. Well, first of all, when you develop your housing policy and campaigns, just think a lot about intersectionality. So think about like disabled people and people who are from the LGBT community, ethnic minority communities, and talk to us and work with us to amplify disabled people demands. We believe there are so many different taxes, so many different things we can do together, from demonstrations, open letters. If you do a briefing for an MP or develop a paper, try to think about, okay, how will this impact people with protected characteristics, specifically disabled people, and talk to us if you're unsure about what to include in there. And speak to the media. When you speak to the media, also do talk about disabled people if you can. Remember that disabled people are not a minority. In London, there are 1.2 million people, and in the UK, 16.1. and 9.5 in England. So lots of people are disabled. In terms of specific policies, when we call for more public housing, don't forget to mention accessibility. We want to really make sure that we build home that people can actually use and access. Otherwise, there's no point of building lots of homes, considering disabled people are overly represented in social housing. Work with DPOs to ensure any system of rent control works for disabled private renters. And then also, again, when we are talking about buying back poor private rentals, don't forget to mention the need to retrofit homes to the highest possible accessibility standards, because we need to look at existing stock. So I guess the last slide is, I just wanted to end with a nice quote from Cassie, who took part in our research. And Cassie told us something that it really stuck with me. She said, when you live in a house that's accessible to your needs, and you can live when you want to, and you can make your own food, and you can use the bathroom when you want to, without support or with support that fits, the moment your housing offers you dignity, your sense of self goes up so much that everything else feels feasible. Thank you so much, and I'm sorry for speaking for a very long time.